Good afternoon. This afternoon we're going to discuss the individual health care mandate and the subsidies that the government has made available to those individuals that use the exchange to help cover the cost of monthly premiums and to reduce their overall out-of-pocket cost exposure. Now, the individual health care mandate states that individuals that are not eligible for health insurance, either through their employer or have not acquired an exemption from the mandate, must obtain health insurance either through the exchange or outside of the exchange, or be subject to a penalty called the individual cost-sharing responsibility payment. Now, and that should be paid the following year by April 15th. So for calendar year 2014, if you fail to obtain health insurance, either for the entire year or a portion of the year, it is your responsibility to pay that penalty by April 15th of 2015. Now, when you sign up for healthcare insurance coverage on healthcare.gov, you will answer several questions about projected 2014 household income, the number of individuals in your house, and how many eligible individuals will be included or covered by the healthcare insurance policy. Now, upon completing that portion, you will have a chance to choose your plan, which is where the quote-unquote sticker shock comes in. And it's not really as much of a sticker shock as some people believe, given the fact that most people that obtain their health insurance from their employer have been receiving substantial subsidies for decades. Now, there are basically two types of cost reduction benefits. The first is the premium tax credit, and that has been discussed at length in the media. Now, although there's plenty of confusion about how the exchange and the premium subsidies will work, most people seem to be aware that the subsidies will be available to help a lot of people pay their health insurance premiums. Now, there is another ACA-created health insurance subsidy that has received little or no attention to date. And it's an extremely important one if you happen to be on the lower end of the income scale. Now, while premium subsidies help pay the cost of health care insurance itself, cost-sharing subsidies are available to lower the out-of-pocket exposure for eligible enrollees. Cost-sharing refers to the portion of a medical claim that the insured must pay, usually in the form of a deductible, coinsurance, or copay. Now, this does not include your premiums. It does not include any balance billing, which is the difference between the amount that your provider, your healthcare provider, charges and the amount that your insurance will pay. The remainder is what is going to be charged to you, and that is called balance billing. And it does not include other expenses that are not covered by your health insurance policy. Now, plans on the exchange are designated as platinum, gold, silver, bronze, or catastrophic, depending on their actuarial value, and I'm going to discuss that at length in the second set.